instead. Welcome to Voices from COVID's Frontlines, a healthcare workers panel. This is part of our annual Santa Monica Reads program. This is our 19th year doing Santa Monica Reads, and it's one of the longest running programs in the country. So we're very proud of that. My name is Jennifer Boyce. I'm a librarian with the Santa Monica Public Library. This is my third year as the chair of Santa Monica Reads. And Santa Monica Reads is part of the summer reading program. So please make sure to sign up for that. You can register online at smpl.beanstack.org or in person at the main library. So that is for all ages. We hope that you'll join us for that as well. We are hosting a series of book discussions for Santa Monica Reads and two special events, today's program and Emma Donahue's author talk on Saturday, August 21st. You can link to the schedule through our resource guide on our website at smpl.org. Just a few logistics about today's program. The participant video and audio, we request that you keep that off for the duration of the program. There will be a Q&A at the end, and you can ask questions through the chat. And then we ask that you, at the end of the program, that you fill out a short program survey. It will take less than 5 minutes to complete, but it's really helpful for us to get feedback about your experience with Santa Monica Reads. Without further ado, I would like to introduce our panelists for today's program. If you are viewing the screen with everyone who is here, if you click in the right corner of the video of the panelist that's talking, you can pin them, I believe you can pin the active speaker as well. So that just might help in terms of your view. But we have here with us today Jill Carrion. Can you wave, Jill? She served on the front lines of COVID as a ward clerk at Kaiser Permanente West LA Medical Center. She is also working towards her Bachelor's of Science in Nursing. Upon completion, she hopes to continue to be able to serve her community as a healthcare worker and resume her hobby as a hula dancer and choir member at St. Monica's. And then we also have with us as a panelist, Dr. Denora B. Chinchilla. Can you wave? She's in her scrubs. She's at work today. She is a board certified internal medicine pulmonary critical care physician. She currently practices at UCI Health as a pulmonary and critical care specialist. She earned her medical degree at UCI School of Medicine, internal medicine residency she did an internal medicine residency at Harbor UCLA and fellowship at Cedars-Sinai. Chinchilla enjoys teaching medical students and residents in the intensive care unit at UCI Medical Center's Douglas Hospital. And then our moderator today is Lindsay Call. Can you wave? Thank you. She is the Chief Resilience Officer for the City of Santa Monica, overseeing the city's disaster preparedness and response programs, and has served as the city's COVID-19 Emergency Operations Center Director. Lindsay also served in emergency management roles for Providence St. John's Health Center and LA County Department of Public Health. So we're very excited to have all of you here with us. I am going to turn my video off so that the focus can be on our panelists today. But I'd like to turn it over now to Lindsay to ask our panelists a series of questions. And feel free to make comments and put questions in the chat throughout the program. And then we will have a short Q&A towards the end, or at the end. Thank you.
Excellent. Thank you so much, Jennifer. And before I forget, because I've got blonde hair, let me thank both of our panelists today for participating in today's event. And more importantly, everything that you've done to serve your patients and our community the last year and a half. We'll get started. I know you both had an incredibly busy last 2020 and 2021. To kick us off, would you mind describing your typical workday during COVID and how it differed from pre-COVID workdays? Doctor, do you want to go ahead and get started? Kick us off?
Sure. Thank you for that nice introduction, Jennifer. So, I mean, as she said, I'm one of the critical care pulmonologists here at UC Irvine, and so primarily served the Orange County area at the time. But, when I was in fellowship at Cedars-Sinai, I got at the tail end of my fellowship is where I started seeing the inpatient side of COVID-19. And previous to this, typical ICU care is you get a lot of everything. People young, sometimes not as often, but middle-aged, high advanced age people with different diseases, different comorbidities coming into our unit. Sick, and I take care of the sickest of the sick in the intensive care unit. So, the majority of patients, I would say, I would see, either temporarily get better and was able to get them out of my intensive care unit with some deaths, here and there, sprinkled here and there. But how that differs from the COVID-19 pandemic, it was like day and night. I mean, our entire ICU lacked anything other than COVID-19, hypoxemic respiratory failure, just patients doing very poorly from a lung perspective and breathing perspective, and a lot of them on the on breathing support, basically depended on a breathing machine. A lot of death, a lot of death. I have never lost so many patients in a short period of time. So it was definitely a very difficult time, not only from a medicine standpoint, but from also kind of an emotional standpoint. I mean, I didn't become a doctor to lose so many patients. I became a doctor to try to save lives, and it just was not happening with COVID-19. And the patients who did make it, they were not the people they were before. Again, keep in mind, I have a very biased opinion. I see the worst of the worst, the sickest of the sickest. And all of that was like an emotional burden, from the fact that people were passing away so frequently to like the emotional distress of having and not have family members be at the bedside and being able to tell them in front to like face to face that, with their loved ones there, that, they weren't doing well. You had to have all these difficult conversations over the phone. So very different beast that I'm used to. And I can't emphasize enough how emotional distress we had on the front lines.
And thank you for sharing that. And I can't imagine, Jill, I know you played a role talking with families and playing. How was your work day what was it like, and how was it different than before?
Well, I mean, starting from just coming in, the difference was, getting temperature checked and someone asking if you had any of the list of, 10 plus symptoms within the last 24 hours, and wiping down everything at the nurse's station when you first got there, and frequently. And, when we first started, we didn't really know much about it. So all we could do is just try to maintain our areas clean. I mean, I mostly was just a support staff for the nurses, I feel. I mean, compared to what I mean, I did see a lot of things with the patients for sure, and the families, like you said, it was a lot more stressful dealing with them on the phone because of their intensity and of wanting to know what's going on with their family member. And at first we didn't have any way of them to visually see them, and we weren't even sure about having someone bring their personal belongings to the hospital and we give it to them. It was just a lot of unknowns. And yeah, I was just mainly trying to answer the phone calls the best I could, kind of reassure the family members as best as I could, just try to keep them connected with their family members through phone.
And Jill, tell me a little bit about what your role on a normal day is in the hospital, for people that don't know what that title means.
Sure, yeah. So ward clerk, transcriber were kind of like a secretary of the nursing unit. It with the electronic system, it's a little different of the role. Before it was, we would have to read the doctor's, illegible handwriting and put in the orders, things like that. But now it's all electronic, and I mainly just make sure we have enough supplies. So that was definitely a hard thing to try to keep up with. I mean, it was already kind of an issue before, but not in a sense where it was, you know, jeopardizing someone's safety as much as we didn't know what was really going to happen, what could happen if we didn't have it. So it was a lot of going down to the stock room and picking up stuff for our, because I worked the mid shift of the day, so I would have to make sure that there's enough for night shift also, since there wasn't a distribution management, materials management person to deliver any supplies to the nursing station during the night shift 24/7. It was just till 11 p.m. And I, I just answer the phone calls, the doctor, call the doctors for the nurses, especially if they're in the room and they can't come out right then and there. They just, call the staff assist light from the room, and or the call light, and just, I'll have a way of trying to get the communication to them somehow.
I can see the parallels between both of your jobs and the characters in the book, which is so interesting to me. But tell me, how did your training and your education prepare you for this pandemic or not? Were you, Denora, were you ready to handle this kind of incredibly long incident?
So I'll say this, like, I think in the medical field, I feel like even without COVID, there's a lack of curriculum, like structured curriculum in medical school to prepare you to see death. Some medical schools may be a little bit more prepared than others, but even in talking to my colleagues, I don't think that anybody believes that we're well prepared to deal with death. The rates of depression among medical providers and healthcare workers is very high and above the average of the normal population. The rates of suicide are higher as well across the board. So I think that in itself tells you a lot. And if even during normal times, we're more affected by depression, suicidal ideation, then imagine a pandemic where now it's 10 times as much death in a week, and no time to go exercise and go out to have a good meal and go out and have fun with friends to try to address that feeling, all those emotions you go through when you have death. And like I mentioned before, we didn't become physicians to lose patients. We became physicians to save lives and to make a difference. And not being able to do that because of the lack of treatment options to increase survival was lacking then and still lacks now. The only things we have are one medication that improves survival by a couple percentile. And so, I mean, no, we're not prepared. We weren't prepared. And I think it highlights the need to improve medical education in this aspect of medicine.
Well, and I don't think any amount of book reading or clinical experience can prepare you for, no breaks, no release and enjoyment of the things that you normally do, having dinner, you were saying, having dinner with friends, going out on a run, even a normal trip to the grocery store was not normal in 2020. So Jill, what about you and your training and education? Any pandemic classes or anything that got you ready for this type of event?
I mean, only other than knowing like, basic hygiene and hospital protocols on like, you know, contact precautions, like, wearing gloves when you're close to the patients, but not really. And I can kind of see what Denora is talking about with, not being prepared, being in the medical field and not being prepared to see what you're going to see. I think that I do have a great advantage while going to school for nursing, that I do work in the field because I see what we're going to be dealing with once we graduate. A lot of my classmates, the first times in a clinical setting, I was there talking to them about how they felt about it. It was like, oh, I don't know if I can do this. And, I'm just there to try to reassure them like they can, like we'll help each other out, and that's very much the environment that it is, especially during the pandemic. It was, you know, everyone just pitch in and, have each other's backs. That's really I think the most important thing that was, just it really helped everything during the day, just to get by, just to get through. But yeah, like seeing the condition of the patients just totally change in front of your eyes was insane. It was very difficult to see that happen, for sure. Yeah, but like I said, I think that my teams that I work with, all my employees, all my nurses, my doctors, I think that we're all very open to having conversations day to day about how we felt about everything, frustration, sadness, everything. So I think that helps. But yeah, it was very difficult because it felt like everything was changing from minute to minute. I mean, the good thing is that Kaiser, they, at first we kind of just got thrown in like, okay, you're the unit that's going to be the designated place. But then it started growing in numbers of the patients coming in and the level of care that they needed. And so I think that Kaiser was very good about trying to, okay, we need to have a way of telling these updates to our staff about what to do, what we're going to do. I know they're upset about the N95 situation. Let's try to figure out a solution. I mean, it was, albeit a little unconventional, that you would think as someone who's thinking, one-time use versus let's reuse them as much as we can because there's such a limited supply. But, they really did everything that they could to communicate to us how they're working hard just as much as we were working hard.
And reusing supplies and being short on supplies and everything was something that happened in the book as well. And during the 1918 influenza pandemic, were either of you aware of the 1918 Spanish flu before this pandemic? And how important, or would it be important to have an understanding of kind of that history when we're dealing with a similar crisis in the present?
So I was aware of the 1918 pandemic. We talk about it in medical school, and we were waiting for the next wave. I mean, it's not something that we were surprised about necessarily, but we just didn't know when it was going to happen. We knew it was coming. When it was coming is the unclear, that's what we didn't have clarity about. And yes, I was still surprised. You never want, I guess, to be in the middle of a pandemic. And I guess, thinking back when you're a medical student and you're learning about the history of medicine, you don't ever think you're going to be in the middle of a pandemic. So I don't know. I guess at the time I was just like, oh, wow, yeah, there was a big pandemic. This seems like crazy what happened back in the day. I hope it doesn't happen on my time. And then boom, I'm like, the field of medicine I chose is the one that got hit the hardest. So learning about it, did it prepare me? No. Should we have been better prepared for something like this? Yes. As scientists, I think we knew it was coming. And I think let me see how I phrase this, the scientific world, including the CDC, the World Health Organization, there was a lot of unknowns. And I do think that as soon as we knew that things were getting out of hand, maybe we should look back in history and be like, is this what that looks like? And should we respond much faster than what we did? It's not, I don't know. I guess that's the way I kind of have viewed this. We have made leaps and bounds, I think, from, a year ago, a year and a half ago, as not only as a country, but I think worldwide, we're all have now taken this very seriously. I think in the beginning, even healthcare providers were like, meh, meh, and then when we saw things get serious, people became serious. So I think we could have done a better job, but our generation was not there in the 1918. So I feel like maybe there was some lack of maybe historical experience, personal historical experience that maybe would have helped to be better prepared for something like this.
Well, and in my opinion, like we have somewhat short memories when it comes to more recent epidemics and pandemics with H1N1, H5N1, Ebola. I served at one of our community hospitals during Ebola, and it's like, didn't we learn that then? Jill, what about you and your background and knowledge on 1918 influenza pandemic?
Yeah, I mean, I really didn't know that much about the 1918 Spanish flu. I mean, I do remember it mentioned in history books back in, middle school and high school, but I think that maybe it could have been beneficial in knowing how it was for the communities in 1918, how they dealt with the pandemic then, to maybe then the modern community responses to the quarantine lockdown, because it was very divided. People like, this is crazy, my freedom, and but then other people being completely just trying to be by themselves and just I know my area, I'm cleaning my area and being secluded. But then again, there's also those after effects of loneliness and the other extreme of that. But I think that would have made a difference if it was talked about in school, about how the nation kind of came up from that, how they first acknowledged it, and possibly like even just incorporating some kind of visual example that would maybe divide the class by like how many people who got affected by the Spanish flu and then not, and then how many died, and things like that. But maybe even also incorporating a portion of like epidemiology and microbiology, and talk about the Spanish flu in like biology classes, to kind of if we had that kind of knowledge prior to all of this happening, I think that could have been something beneficial. And yeah, like Ebola too. I think I was just talking with my coworkers about that. I feel like we had a bigger response with that, then coronavirus, and I thought that was a very profound thing that I don't know. I was just, wow. It was just incredible to think about that.
Yeah, we had a Ebola team
Yeah.
when that happened, like that. Everything was shut down. Halls were shut down. Like people were wearing spacesuits. And when the coronavirus, COVID-19 came up, it was like we weren't even allowed to use masks because other healthcare providers or other people would be scared of this thing. It was just such a weird, like, just so different how we handled it.
Mm-hmm.
Yeah, absolutely. And I studied emergency infectious disease control as part of my academic career. And I'll tell you, I mean, I studied pandemics and epidemics all the time, and nothing is going to prepare you for, what you're experiencing firsthand, especially if you're on the front lines. And speaking of, so The Pull of the Stars, if anybody hasn't read it, highly recommend it. It's a riveting portrait of women on the front lines of a medical catastrophe, and they're doing heroic work. Similarly, healthcare workers have been portrayed as heroes during COVID, and in my opinion, are heroes. Have you seen burnout amongst your colleagues, or a new interest in the medical profession, or both, because of how medicine has been portrayed during this pandemic?
I think that there's both. In the ICU, where the sickest of the sickest were increasing, and the need for more beds, meaning more nurses, which we really didn't have. There was some burnout, and there were also employees who did get sick, but were made recoveries. But it was the ICU nurses, some of them transferred to, once it kind of dwindled down a little bit, right before that second surge, there were some of the ICU nurses that transferred to a different clinical department, once that department was open, just because they wanted to get away from the long sleeve gown wearing for the 11 and a half hours of their shift, their N95s just like cutting into their face and their nose, and then wearing it's just like a hot suit, the face shield with it too. It was just like a hot suit to be wearing for that long amount of time. And I think that there was a lot of stress about, it was so much for them to do, that their patients, doing everything that they could, and their patients weren't improving as fast as they would hope. But I am in the interesting position of also getting into nursing school during the pandemic. Actually, about a year ago, I got into nursing school, and I'd been trying to get into a program here in California or locally in LA, for almost 2 years. And so I think that I'm in the unique position of, kind of questioning it on that end, seeing how I had experienced the pandemic. But I feel very hopeful about it. We also did actually get some new grads at our unit, at our hospital, and several different units of the hospital during the beginning of COVID, like right before, I think it was like early March, they had got brought on, and they usually have like a full year of working with another nurse while they're on the floor, but it got cut down to like 6 months. So they were just like thrown into it. A lot of the times our more senior, because I work at a step down unit, which is kind of just a step down from ICU. And a lot of our more senior nurses were having to float to the ICU units to make up for those staff deficiencies. And then these new grads were just there on their own with stroke patients and, really sick patients too. So I think that there that there's they were very very resilient in trying to just, they were like, well, this is my new career I just entered, I gotta make it work. So yeah.
As far as like in the medical, the physician role, I guess there was a significant increase in medical school applications. Now, whether was that affected by the pandemic itself, or because now they're not requiring the MCAT, or because now there's no in-person interviews, and I don't know. It's difficult to say because we don't have a control for that. There's no way for us to determine, like, obviously I'm a scientist, so I think of like all the biases that come into play when you look at these sorts of things. Some people say, oh, the reason why is, and this is all theoretical, is, more people want to go into the medical field because the physicians are looked at as heroes now. And, the medical field in itself, becoming a physician is a very, what's the word I'm looking for? Prestigious field. So, people sometimes go into medicine because of the title and everything that comes along with it. And maybe there was some of that because of like how we were being portrayed, I think to our community. So there's that. And then as far as like the other end of it, we had people who were like borderline retirement, and they're like, it's time for me to retire early. I don't want to be exposed and die from the disease. So I had a lot of attendings who were like, I think I'm on my way out. I'm retiring early. Some people just worked from home during that period of time and decided to dedicate their time to maybe research more than just face-to-face patient care. So I think there was a little bit of both as well.
Yeah, I completely agree. And with our demobilization plan for COVID in our emergency operations center, we put mental health is health, and trying to remind ourselves that, acknowledging our own burnout after having worked on COVID day in, day out for the last over almost, it feels like 2 years, just to remind ourselves that, we need time to recuperate. While COVID's a shared trauma for everyone, we've all experienced it differently. Our experiences are different, having worked on it daily versus the public and patients, their family members. What should people know about the frontline worker experience during COVID? Jill, any thoughts?
Well, people should know that we all wish that we could have been with all of their family members all of the time, or when they expressed any kind of, because I'm sure it was lonely being in a room and closed for 24/7, or at least have some eyes watching them, seeing any of the acute changes too. For me, it was hard just to have the patient wait in the room and hoping that someone would come and assist them, because especially if they called, I usually, as a work clerk, because I wouldn't want my family being in there waiting, like, I just called like 15 minutes ago, still no one's come. As a work clerk, I normally, non-COVID, I would go in and kind of reassure the patient, like, the nurse will be in shortly, is there anything I can get in the meantime, kind of thing. Just so then they know that we're there for them. We're not just, we're not like ignoring them. I felt like, in my perspective, I felt like maybe the patients could feel that way, that they felt very abandoned. So I was doing everything I could for them to not feel that way. And at first, we as work clerks, we weren't fitted for N95. So we did it, once they closed units for, just COVIDs, where they basically, they sealed it off. There's usually like a negative pressure airflow kind of happening in that area. And so then that would and you're wearing all the stuff all the time while you're in there. And so they would allow for the doors to be open somewhat. So it kind of gave a little bit of connection with the patients. But although some of them actually would end up just closing the doors, but I think that just having that possibility of having the door open for the patients to kind of, see human life around them, or, the nursing staff around them, working hard to help them, I think that helped. And um, I I I really just I really was just there to help with menial things like that, I think. I mean, maybe some people wouldn't think it's menial. I do think that my nurses appreciate all those little things, that because it's then one less thing for them to worry about. Just to kind of help, assist them with the FaceTime virtual visits, to once we had that technology, to be able to have the families FaceTime. I would help to coordinate the visit times with them and set it up for them. And, I think that patients' families and friends thought we didn't really want to deal with it, but it really was because of the busy workflow and the added precaution in every move around the unit that made it difficult to do what we have to do every day. But in my opinion, I felt like I did the most I could while I'm there.
Absolutely, and I'm sure that those little tasks are not little tasks to the patient. Trust me on that one, or to the staff member who's you relieved that burden on them. So, Denora, what about you? What would you want people to know about your experience as a frontline worker during this crazy time?
Yeah, I think that how we were portrayed on the media fluctuated a little bit. There were people who were like, oh, you guys are heroes, you guys are in the front line, and yay, and you guys are amazing, to like, oh, the doctors are like, because of extra money that they're getting, they're like falsifying death certificates and overcalling COVID-19 deaths. And it came in waves. And so if I could say or tell people or communicate with people, one thing I would want them to know is that healthcare workers would never do that. We don't get paid extra for nothing. We provide the best care that we can, and we did, and we do, and putting our own lives at risk. We lost some of our own during this pandemic because they put their lives at risk. We put our families at risk. And not that we need to be called heroes. We don't need that, because we are doing it because this is our passion. But we don't tell people to wear masks because we want you to be uncomfortable. We don't want people to think that we're asking them to get vaccinated because we want to put you guys at risk for some complication from the vaccine. We don't do these things to harm people. We do these things because we want to prevent death, because we want to keep our numbers down, because we want to see the spread of COVID-19, because we know it works, and the benefits, if we recommend it, is because the benefits outweigh the risks. And if I had one thing to say, is trust me, we're not doing anything that we think would hurt anyone. We can't hear you, Lindsay.
I was saying amen. Hallelujah. Yeah, I completely agree. And just for me, how it was so heart-wrenching, having, spending hours upon hours working with staff who were coming down with COVID and providing support to our local hospitals. And then especially in December and January, seeing restaurants still open, or people refusing to wear masks and things like that, where they could be harming another person and putting them in your care and creating more of a burden on you. It just broke my heart. So I appreciate that. But thinking of the positives, can you give an example of resiliency that you saw during this unprecedented time, either in your professional life or in your personal life?
Every day I saw my coworkers return to their job. That is an example of just resiliency. I mean, yes, we did get frustrated with the abrupt changes and policies and what new things we have to do day to day. But we thought we had to work with what we had, and that we had to trust that the infectious diseases team would update us on anything that we needed to know. Personally, I see resiliency in myself being passionate to still become an RN. I mean, every day someone still asks me at work, "Are you sure you want to be a nurse?" But going, and like Denora said, like it's like, if you strip all of that away, it's still the passion of going to nursing school to be able to help people, to be there for our patients, and going to nursing school and working in a hospital during the pandemic, I felt very lucky to be able to help the community as much as I did. And at its core, like, being a nurse is being the advocate and the active healer for the patient, whether it's physically, physiologically, emotionally, all for them. And so I really think that all of us have that characteristic that brings our resiliency during this time.
Same here. From the janitors to the RTs to the nurses, increasing their ratio of patient to nurse that they were doing, from the doctors, from our trainees. I mean, at every level, people really stepped up to the plate. People came together, people would show up to work. People, we worked together as a team during this awful time. And I feel like that's a great example of resilience. And people, nurses were starting to burn out. People were working overtime. RTs have higher ratios. I mean, like I said, at every level, I can't even imagine what we would have done if, yes, RTs are respiratory therapists. I can't imagine what we would have done if people were like, "Peace out, I'm not coming to work." I mean, I don't know I can't be at the bedside to manage all the pumps and all the drugs and then take care of like 20 other patients. Even we were taking care of patients at higher numbers than we're used to. And there were really sick people. I mean, we would say like a normal intensive care unit is full of, say, 20 patients now. Some of them are sicker, some of them are like better, some of them are like, no, like when COVID era was like nobody else but COVID-19 and really sick people. You were like trying to get through rounds, and there was a code blue, which is like when somebody has a cardiac arrest, you run over there and have to stop rounds, and then you were finished with that. Oh, another patient's unstable. We got to go to the other room, and it was like constant, every day, all day. We worked so many extra shifts. Everybody at every level. It was amazing to see. Obviously, the people come together. Not amazing to see what we went through, obviously.
I agree. That's the thing that's gotten me through this is my work family, by far. And people, in the city of Santa Monica, there are only 3 of us who really know anything about infectious diseases. And so we depended on so many different departments that had no experience in emergencies, no experience in disasters, but they dropped everything to serve. And that I agree that the human connections kind of what makes us the most resilient. So, and final question, we're kind of approaching a 3rd wave. I'm hoping we don't approach a 3rd wave.
Don't say that.
No, knock on wood right now.
Everybody get your vaccine. This is my advertisement. If you haven't gotten a vaccine yet, please do so now. But we're seeing numbers creep up just a tiny bit.
No, say that. I get so anxiety.
Okay, so it's nothing's happening. We're all gonna stay flat. What are your hopes for the future as we end the fight on COVID, and most importantly, we rebuild and we recover?
For me, I think we've made so much progress up until now. I think my hopes that people, those people who are hesitant to get the vaccine, that they get the vaccine, whether they've had COVID or have not had COVID. We now are like way past like what the COVID vaccine started maybe December when it got like open to the public. We were the first line people to get it. I mean, I think now I'm like, it's July, 7 months in, I'm fine. Like just get your vaccine. Kids are getting vaccinated above the age of 12, get them vaccinated. Once they open it up to little kids, I'm rushing my 5-year-old and my 2-year-old to get their vaccine. I think just get vaccinated, and if you can, hold off on having reunions with people who haven't been vaccinated. Just make small cohorts of people who are vaccinated, have gatherings of people who are vaccinated, but wear a mask when you go out, wear a mask still when you go to the store, even if you're vaccinated. I encourage you to do that. You are not just, don't think about just yourself, but you could still get COVID-19 if you're vaccinated. Obviously, your likelihood of having serious disease is very, very low. And even of obtaining the getting exposed, or I guess becoming infected with COVID-19 is low, but not impossible. And so be the responsible person of walking out to the store and wearing a mask, so that somebody who hasn't gotten vaccinated, either because of social economic issues, because they don't have a car to take them somewhere, because they're scared still, because of whatever reason, maybe take it upon yourself to reduce the risk of exposure to other people who are not yet protected, or kids themselves who don't have the option like to get vaccinated at this time. So if I get so much anxiety just thinking about another wave, because it was so horrible, the experience we went to, that I look at my phone like every day when I go to sleep and I track the numbers. And I'm like, oh my God, the numbers are going up. Like, think about maybe a little bit about us. You guys aren't the ones who are going to be at the bedside exposing yourself and your family members, because my kids can't get vaccinated yet. Just wear a mask and get vaccinated, and tell your friends and your family members, if you've gotten vaccinated, how safe you feel about your decision.
Yeah, I would agree 100% with that. Just people being more willing to get vaccinated. I understand everyone's preference, everyone's health is their own choice. I get that. But I think that at a time like this, we all have to be thinking about our family and our friends, just being grateful for what we have right now. Like the numbers that we have right now, it's good. And the research with the vaccines, it's incredible work that yeah, everyone should get vaccinated. But I do hope that we respond more willingly to prevent the spreads. Like, so wearing the mask in the store, like, going out to the store the other day, there are people just in there without it. Most of the people in there aren't wearing any masks anymore. And I just hope that we can be grateful for every day that we're able to wake up and enjoy, for them to understand that we're so thankful for being able to be awake and functioning in a little bit less anxiety than we had in the last few months or year. But I hope that we have a greater consideration for the well-being and safety of our loved ones and our neighbors.
And globally, I mean, we're so lucky to see our numbers in our nation like just drop significantly. Look at what's happening in India. Look, I mean, as a small example, like
And even in Europe too. I have a cohort mate who she's from Croatia, and she said the Europe numbers are going up too.
I mean, it's everywhere. We're the only nation who, luckily got a hold of a vaccine so early, and it's working. And it goes to show, like, Canada is doing pretty well too. So, I mean, that, like, not traveling internationally would be another thing. The more this virus spreads, it's just a matter of time before there's a strain where the vaccine doesn't work.
Right.
And are we really going to wait for that day? Let's just get herd immunity, get it done in our country and worldwide, because it's just a matter of time if we don't get this under control.
We're clearly all drinking the same juice. So I completely agree. And I would add, my hope is that just that we not only think of this as one single pandemic, but the lessons that we've learned for any type of emergency. So we're that much more ready for whatever comes our way. Knock on wood, nothing will, but we're that much ready for and build that community resilience. So, okay, Jennifer, I'll turn it over to you for Q&A, I think.
So thank you so much to our panelists and Lindsay for moderating. That was really informative. I think, many of us were watching the pandemic through the lens of the news, and also some of us may have had personal direct experience with it as well. But I think to hear more about what's happening behind the scenes is really informative. So we really appreciate your time. And for those of you that have not had a chance yet to read The Pull of the Stars, we may have some giveaway copies left at our service desk, but if those it's while supplies last. So if those are gone, we have added additional copies to both our physical and ebook collection. So please make sure to check that out. And then we will have some upcoming book discussions. You can link to that through our resource guide, which is at smpl.org. It's on the rotating billboard. Just click on the image. And then for anyone that may have joined us late, I just want to mention that we have an author talk with Emma Donahue on Saturday, August 21st. That does not require registration. So I hope you can join us for that as well. We are at 3 o'clock already. So for those of you that need to step out, and that may include Denora because she's at work, I do want to just thank the Friends of the Library for supporting Santa Monica Reads. They have been with us for many, many years funding this program. So I just want to share the link to their website in the chat. And if you would like to become a member, that that helps to fund library programs. So please take a look at the work they're doing. And then I'm just going to ask that, hang on, I'm having trouble copying and pasting this link. If you're able to please fill out a survey about today's program. It will take less than 5 minutes to complete. I will also email it to everyone who attended today, but if you could do it now, it's more likely that you'll actually complete it. So I'm gonna go ahead and throw that link in the chat as well. I think someone is unmuted. If you could remute yourself, please. Denora, I see you looking at your watch. Are you able to stick around for Q&A, or do we need to wrap up?
No,
Denora's at work.
I'm just addressing a couple text messages.
No problem. No problem. Okay, just checking. All right, so for those of you that can stay, we will do a short Q&A, and for anyone that needs to step out, feel free to do that now. I'm going to keep the recording on while we do this portion. So I just saw a few questions in the chat. Feel free to go ahead and add any additional questions that you have now. Denora, at the first part of the discussion, I think it was question number 2, you mentioned of a drug that helps to increase the chance of survival for COVID, and someone was asking what that was. Do you remember what you were discussing?
Yeah, so I can't remember when this trial came out, but it was the only hopeful drug that gave us maybe some light of potentially having some improvement in mortality. And the trial actually was stopped early because there was some suggestion, and it wasn't like our typical randomized control trial that we have for most of our drugs that don't have any biases that can affect outcomes, and that was dexamethasone. But it's only in the inpatient setting, and the people who benefited the most were people who were on the ventilator.
Thank you. Nancy had a question. She asked, I'm curious to know when, and then she put in parentheses, American hospitals first started having to deal with COVID. She says, I think most of us didn't realize how serious it was until mid-March when everything came to a halt. When did you first start seeing patients with symptoms?
I'm primarily on the inpatient side. So in the ICU, I do take care of outpatient patients, but they're primarily pulmonary patients. So I think when I saw my first patient was somewhere in March, if I remember correctly, like late March, when we started to see our numbers creep up on the inpatient side. And yeah, it wasn't taken very seriously in the beginning. I think towards end of February, I remember people starting to talk about, hey, there's this new viral disease that affects the respiratory system predominantly, and it's making people really sick over, in China, and it sounds like it's starting to spread. People started saying, oh, it's not a pandemic, it's an epidemic at this point. And then when the announcement was made, it was a pandemic, when we started to see some of our LA numbers go up. So maybe end of March, if I remember correctly, of 2020.
Thank you.
Yeah, it was about like the middle of or beginning of March, we started seeing just a couple here and there at our hospital inpatient.
Okay. Yeah, I'll just add that I actually read an article in December of 2019 about COVID, saying that it was very likely that it would be a pandemic and that it would come to the US. And I remember thinking, well, I don't really know what I'm supposed to do about it, but then it unfortunately did happen and did turn into a pandemic.
Yeah, we were keeping a close eye on it. January and February was the first time I briefed the city manager on COVID, because I remember that meeting. But again, having gone through H5N1, H1N1, etc., you didn't really have a true sense of how good the information was coming out of China, how much it was going to have a global spread. direct contact diseases are sometimes more difficult to transmit. But as soon as those masks came out, and that was my turning point, understanding, once we understood, hey, this is an airborne disease, that it was going to get pretty hairy.
Yeah, thank you for that. Let's see here. I hope the panelists, I know you were talking, but I hope you had a chance to read some of the comments in the chat. They're very complimentary. Let me see if there are any other questions. I'm not seeing any other questions at this time. Does anyone want to add anything to the chat? Or maybe we answered all of your questions already. I know we're a little bit over time, so people may need to head out. All right, I don't see any additional questions unless, Lindsay, do you have any questions for the panelists? Well, you asked all the questions already.
Yeah, I just want to thank both of you for what you've done already in your careers, but what lays ahead, and especially good luck to Jill on becoming a nurse. And my mother is on the call, and she is a nurse, so I'm sure that made her incredibly happy.
Oh, thank you.
So there is one more question in the chat. This person, Carrie, is asking, I wonder if the very sick COVID patients in third world countries have comorbidities as in US. I'm not actually sure what that question means. Does someone want to?
Yeah, so comorbidities are basically other medical issues that will predispose you to having some sort of disease. So I don't know the answer to that, but what I will take the opportunity to say right now is that there are two specific populations who are very disproportionately affected during the pandemic, and that is the Latino population and the African American population. There were not only more at higher rates of contracting the disease, but also higher rates of being in the ICU and mortality. Despite the treatments not showing any disparities within effectiveness within the populations themselves. So it just highlights I think, the fact that both of these populations are populations that have socioeconomic determinants of health that affect healthcare outcomes. Including but not limited to access to good parks around their area, because they live in areas where it's unsafe probably, or they feel unsafe to be able to exercise in their communities. Low access to healthcare, so either because they're uninsured or underinsured, and therefore their comorbidities are not addressed. Access to healthier meals, because unhealthy meals are cheaper than healthier meals. I mean, I go to Costco and I spend $300 because I buy a lot of fruit and vegetables. So unhealthy food is much cheaper. When you look at what predominates healthcare disparities, one of the things is they say it's factors that are affected by what you do. And all those factors, I think, affect what you do. So just as clarity is that, our patients that suffer the most are highlighting the fact that we need to increase access to our population in hopes that everybody has the opportunity to be able to seek all and improve all of those factors that I just mentioned.
I'll just quickly chime in. Absolutely agree. My background, other side of my background is African studies, and studied a lot on international development and public health. And while we saw a lot of the comorbidities with COVID in the United States being diabetes, obesity, which may not be as prevalent, for example, in African countries, there's a huge amount of smoking in developing nations. There's greater incidence of other infectious diseases. So the comorbidities may be very different with COVID, and I think it's kind of a wait and see game. see what the impacts are going to be. And the fact that so many of those nations don't have access to vaccinations. If you look at the worldwide vaccination map, it is incredible how fortunate we are, and how little access developing nations have to vaccination. So it's not over yet.
Absolutely, 100% agree with that.
Well, thank you so much again to everyone, and thank you to people attending who asked questions. I think that last question was especially informative in terms of your answers. And I hope that everyone will have a chance to read The Pull of the Stars and attend other Santa Monica Reads programs. We are over time, so I'm going to go ahead and wrap it up. So everyone has a great rest of their afternoon, and thank you so much. Bye-bye.
Thank you all.